Hello, this is Dr. Chris Scribbles here from Square One Health, and we are doing our Wednesday live presentation. These are something we're going to be doing on a regular basis. And initially, we're going to be focusing on scoliosis, then we're going to get into some other conditions. But today, I just wanted to start by giving an overview on scoliosis, generally what it is, who tends to have scoliosis, and probably most importantly, what are some things that you can be doing at home to check for scoliosis, and if you do see some potential signs of scoliosis, what can you actually do? So scoliosis is a curve of the spine. It's classified by having at least 10 degrees of lateral bending with rotation. Both of those need to be present to actually diagnose someone with scoliosis. Scoliosis most commonly occurs during adolescence. Typically, it's during that first year to two of puberty and growth spurts in teenage years that curves tend to progress. We're talking about idiopathic scoliosis in this case. And a lot of times it gets worse during growth, especially during the areas of rapid growth. And that first year of puberty is when the curves tend to progress the fastest. Now, adults can also have scoliosis. When we see scoliosis in adult, it could be a scoliosis that they developed during adolescence or childhood that is still present in adulthood, or it could be a new scoliosis called a de novo scoliosis that actually develops later on in adulthood. So this is an example of someone who has a pretty large degree curves. Once curves tend to get beyond 50 degrees, that's a surgical threshold. You'll see things that say 45 to 50 degrees is the limit when someone becomes a candidate for surgery, or surgery may be recommended. And patients with scoliosis, they do frequently develop pain, and they have more prevalent pain, back pain, than individuals that don't have scoliosis. There's some research that shows there is a correlation with the severity or the size of the curve and the amount or intensity of pain. And then a lot of times people start to get some really big asymmetries in their body. And actually, it's the asymmetries that a lot of times affects people the most, meaning we talk to patients and we ask them what concerns them the most about scoliosis. Many times it's actually what their appearance on the outside that concerns them more than the size of the curve or the pain. But early detection and the right treatment can actually stop the progression of curves. And so today, when we go over how to check for it, it's really important that you do evaluate people for scoliosis, because the earlier we catch it, then the earlier we can get people into the overall right treatment. So who can be affected? So first of all, when we look at older populations, when we get beyond 60 years old, about 30 to 38% of the population older than 60 is actually affected by scoliosis. It does tend to run in families. There is a genetic component to scoliosis. So a lot of times you will see people in the same family with scoliosis. It progresses most rapidly during the first year of puberty. So between the ages of about 11, 10 to 11 and 14 is when a lot of the growth or increase in size of curves tend to progress. And when we look at adolescents and children, it's about 2 to 3% of the population. So it's actually a lot more common and a lot bigger problem in adults than it is children. And even once in a while, we will see it in infants, which would be anyone from 0 to 3 years old, or even in juveniles, which is between 4 and 10 years old. But we call that early onset scoliosis. It's generally thought that there's less than 1% prevalence in infants and juveniles for scoliosis. So idiopathic actually means no known cause or origin. Now, we don't know exactly what triggers idiopathic scoliosis. We know there's probably multifactorial. There's probably a genetic component in combination with some environmental factors. But we really understand once the curve in idiopathic scoliosis begins, we know how that progresses. And 80% of all scoliosis are idiopathic scoliosis. There's many other forms of scoliosis, such as a neurological scoliosis or a syndromic scoliosis, which is the scoliosis that's secondary to some other syndrome like Marfan syndrome. We'll talk about those on a different presentation. But like I said, there is research that shows that there is a genetic component or link with scoliosis. Scoliosis can present when someone's younger and continue to progress and get more severe, like I mentioned, in adulthood. And a de novo scoliosis, a degenerative scoliosis, can actually develop in adulthood itself. Now, early detection leads to the early and most appropriate treatment, and that's what leads to the best outcomes. So it can be the difference between someone that has a successful outcome and someone that ends up having a potential surgery, is getting that right treatment early on. And then even in adults, a lot of times early treatment or treatment in early adulthood can make a big difference in how adults are potentially impacted and affected by their scoliosis later on in life. So the Scoliosis Research Society came out with a position paper in 2015, or a statement, and they said that they do recommend regular scoliotic checks. Since we don't have standardized or government ran scoliosis screenings in most states in the US nowadays, they do recommend people still get screened. And it's recommended that girls be screened for scoliosis by a trained professional at the ages of 10 and then again at 12 years old. And then a boy should be checked between the ages of 12 to 14, right around that time. Boys a little bit later, because generally they start to grow and develop a little bit later, during that adolescent time frame. So what are some of the signs of scoliosis? One of the big ones I'm going to go over is you're looking for major asymmetry. So one of the main asymmetries that you can look for at home is, do you see an unleveling of the shoulder? Do you have one shoulder higher than the other, like you see in the picture on the left? Do you have a shoulder blade, a prominent shoulder blade, or a shoulder blade that tends to stick out on one side? Do you have rib humping? When someone bends over at the waist, do you see a rib hump on one side? Do you see an asymmetry of the waist? If they have a curve in their lower back or their lumbar spine, you may see an enlarged indentation on one side and a flattening on the other side. And then do you just notice any obvious curves in the spine itself? And then another potential thing to look for is, do you see an unleveling of the waist? Does one hip seem to be higher than the others? Do you notice on pant legs that one side seems to be longer on one side or shorter on the other? So looking for obvious asymmetries is the easiest way to detect scoliosis. When you look at their arms hanging down, do you see one hand, or do you see their fingertips closer to the ground or hanging lower than the other side? Another common asymmetry. So if you see any of these asymmetries, that could be a sign that there's an underlying scoliosis that's driving that asymmetry. This is the rib humping. This is the most prominent when you have a scoliosis in the thoracic spine, which causes the rib hump to develop around the rib cage. But even in the lower back, you can see humping, but it's just not as prominent as rib humping when we see it in a curve with a scoliosis in the thoracic spine. Now, any of these signs, like I mentioned, may indicate that there's an underlying scoliosis. And if you see any of those, it's recommended that you get your child, whoever you're looking at, to a specialist to have further, more detailed evaluation for scoliosis. And then the gold standard when we see those signs is to do an X-ray, and the X-ray is a gold standard to look at and detect scoliosis. Now, there are some at-home screening things that you can use, and I'm going to talk about one app, especially if you're not close to a specialist or you don't have, maybe you live in a rural community. Here's some things you can do at home. And there's an app called app.scolioscreen.com, and you can download this. It's free, and you can just have your child or your adolescent take their shirt off or stand there with a tank top on or have their bra on, and you can just look at their body and you can answer the questions. So it's going to ask you if you see any unleveling. Do you see a rib hump, or do you see a shoulder blade sticking out on one side? Do you see an asymmetry of the waistline? Do you notice an obvious curve in the spine? Do you see rib humping when they bend over in their upper back or their lower back? And then, do you have a history of scoliosis? And the last question is, are they male or female, boy or girl? Because there is a much higher prevalence an incidence of scoliosis in females compared to males. When you fill that out, based on your score, it'll let you know your risk factor or the risk factor of scoliosis. And you can click on this button here to find the nearest scoliosis clinic or scolio-care clinic, so you can go in for more detailed evaluation. So just understanding how when we detect these and getting that treatment, or like the right treatment early on, is so critical. So you see a normal spine over here on the left, it's a nice straight spine. Then you see over here on the right, you can see the beginning of a scoliosis. There's a lateral bending, there's a slight rotation. It's something that you may not seem like a big deal, but if you look at that middle spine there, if that just goes untreated, you can see how fast these curves can progress in just one year time frame. And so if this would have been caught early on and we had the right treatment early on, this rapid progression can be prevented in most cases. Curves smaller than 20 degrees, a lot of times we just do observation. We don't like to use the term watch and wait because we don't want to wait for it to develop, but you want to do regular checkups either at 3 months or every 6 months to see if the curve tends to progress. But when we have a growing child or an adolescent, when we have a curve that's larger than 20 degrees, that's a lot of times when intervention or treatment is going to be indicated. And that could be anything from scoliosis-specific exercises to custom bracing, or a combination of those things. The other thing with the treatment, there's a lot of things you can do to treat pain. There's things like chiropractic, general physical therapy, there's yoga, there's acupuncture, there's massage. All those things can be great for overall health. They can be great for reducing back pain, but none of those have been shown effective in actually treating scoliosis, decreasing the size of scoliotic curves, or impacting how the curve may progress. But scoliosis-specific exercises, things like Schroth, like C's, chiropractic biophysics, or a newer technique, Scoli Balance, that combines the best part of those previously mentioned, those have been shown effective in reducing scoliotic curves or slowing the progression of curves. And then also bracing. Now, not all braces are the same. A lot of braces work by just trying to squeeze your spine using what's called 3-point pressure system and trying to hold the spine in position, kind of like a cast. But we use a more modern type of bracing that uses, one, they're custom made using CAD/CAM technology that's computer-aided design, computer-aided manufacture. So we use computers to gather all the data from the patient to get imaging of their body, so we can make a brace that's custom to them. And instead of just trying to hold our body in a position and hoping it doesn't get worse, we can actually put the body in a corrected or overcorrected position. And when we put the body in overcorrected position, we can actually impact and control and drive how the spine grows over time. So much different than old bracing. So what does the research actually say about scoliosis bracing? Scoliosis bracing, when prescribed in high-risk patients, has been shown effective in preventing curves from progressing to surgical levels. Bracing is an effective treatment method for adolescent idiopathic scoliosis and has a positive long-term outcomes. Conservative treatment with bracing is highly effective in juvenile idiopathic scoliosis, and juveniles, anyone from 10 or 4 to 10 years old, when we treat kids early on, if we can reduce the size of the curve before they hit those growth spurts associated with puberty, then they have a much lower risk of those curves progressing when those rapid growth spurts develop. Scoliosis-specific exercises like C's, when combined with hard bracing, is highly effective. And part-time bracing in adults has been found to be very effective at reducing pain and reducing curve progressing over time. So, like I said, what you want to do is we want to detect scoliosis early on so we can get to the right treatment early on, because the right treatment early on gives our best chance of having the most success. So if you have questions or comments, just be sure and put those comments or question in whatever platform that you're watching, and we'll do our best to answer those. So this is all I have for tonight, but if you have scoliosis or you know someone that may, or you're not sure, be sure to go to that screening and evaluate them. And then if you know you have someone, make sure you reach out to a trained specialist in scoliosis. At Square One Health, we specialize in scoliosis. We have a Scolio-Care clinic opening soon in North Denver where we will only be doing scoliosis treatment. And if there's anything you ever need, regarding scoliosis, if you have any questions, don't hesitate to reach out to our office. So anyways, Dr. Chris Goebbels here from Square One Health. This is all I have for our Wednesday night live presentation. And if there's anything we can do to help you, be sure and let us know.